75% of people develop medial epicondylitis in their dominant arm. The primary etiology is repetitive stress or overuse of the flexor pronator muscles, which leads to microtears and degenerative changes. It can also be caused by a single traumatic event, such as a direct blow or sudden forceful eccentric contraction. It is often seen in athletes, such as golfers, tennis players, or baseball pitchers, and in certain occupations. Indications to perform the golfer's elbow test include subjective reports of pain or tenderness at the medial epicondyle, a subjective report of pain with forceful repetitive grasping motions, pain with resisted wrist flexion or forearm pronation, and weakness in the hand and wrist, including decreased grip strength. There are no contraindications to perform this test, and differential diagnosis includes ulnar neuritis and ulnar collateral ligament instability. Medial epicondylitis involves a tendinopathy of common flexor origin, specifically flexor carpi radialis and the humeral head of pronator teres. To a lesser extent, palmaris longus, flexor carpi ulnaris, and flexor digitorum superficialis may be involved. Taking into consideration Cyriac's selective tension concepts, putting the affected tissues at end range stretch will lead to pain. Psychometric properties have not been tested for the golfer's elbow test. To perform the test, have the patient seated with fingers flexed in a fist position. Hold the patient's elbow in 90 degrees of flexion and full pronation, while palpating the medial epicondyle with one hand and grasping the patient's wrist with the other hand. Passively supinate the forearm and extend the elbow and wrist. A positive test indicates medial epicondylitis and involves the reproduction of pain or discomfort along the medial aspect of the elbow in the area of the medial epicondyle.
Hi Sandy, how are you doing today?
Good, how are you?
I'm good, thanks. My name's Jordan. I'm going to be your physical therapist today. Okay, so I'm understanding that you have some pain on this inner part of your elbow, is that correct?
Yes.
Okay, when does this pain come on?
Well, I play golf,
Okay.
and it's mostly when I'm playing golf that I feel it.
Okay.
Or like turning a doorknob too.
Okay, yeah. So what I'm thinking, just from what you've said and some earlier tests that I've done, is that you perhaps have what we call medial epicondylitis, which is perhaps inflammation of all the tendons that insert on this inner part of your elbow here.
Okay.
So there's a test called the golfer's elbow test, which looks to see if you have medial epicondylitis. Okay, so we're going to go ahead and perform that. Since this is your uninvolved side, I'm going to go ahead and do this one first. So what I'm going to do is flex your, just put your fingers in a fist here. I'm going to put my hand on the inner part of your elbow. I'm going to be palpating, and I just want you to totally relax. Okay, so I'm going to go ahead and supinate your forearm, and I'm going to extend your wrist and elbow. Any pain or discomfort with that, Sandy?
That's okay.
Okay, so now we're going to go ahead and move to the affected side, or the side that you're complaining of. Again, at the end of the test, I want you to let me know if there's any pain or discomfort.
Okay.
All right, so support your elbow here, slight flexion, your fingers in a fist. Go ahead and relax, and then passively supinate and extend your elbow and your wrist.
Yeah, I feel that
Okay.
right in here.
All right. Okay, so that would be a positive test, indicating that you do perhaps have medial epicondylitis. So we'll go ahead and devise a treatment plan from there. Okay? All right. Thanks, Sandy.
Thank you.